Hi guys, welcome to my channel. It's your girl Diamondja Cosmetics, and in today's video I want us to talk about something very important, and then it's something that is disturbing our community, and then something that is disturbing Nigeria at large and the whole world at large. Okay, so to talk about a very important topic, and that topic is bipolar disorder. Let's start with defining what bipolar disorder is. Bipolar disorder is associated with episodes of mood swings ranging from depressive moods to maniac highs. The exact cause isn't known, it's not known at all, but a combination of genetics, environment, and altered brain structure and chemistry may play a role in this. Okay guys, let's go on to what triggers bipolar. Having a first degree relative such as parent or sibling can trigger bipolar disorder. That means you can transfer, somebody having bipolar can transfer bipolar to their offsprings. Periods of high stress such as death of a lovely one, like you losing your parents, and then the shock of it can give someone bipolar. And other traumatic events, drugs and alcohol abuse. Drinking too much, taking alcohol, and high intake of drugs such as codeine, tramadol, and the rest can cause this very disorder. So it is by this that we're going to bring the prevention of bipolar disorder. The preventions are paying attention to warning and signs, avoid alcohol and drug abuse. Take your medications as directed by the medical personnel. So now let's talk about the symptoms of bipolar disorder. We have the maniac episodes. Symptoms include high energy, reduced need for sleep, and loss of touch with reality. And then we have depressive episodes. Symptoms include low energy, low motivation, and loss of interest in daily activities. Mood episodes last days to months at a time and may also be associated with suicidal thoughts, which is very bad. People suffering from bipolar disorder may experience many mood swings, sadness, anger, anxiety, guilt, hopelessness, loss of interest and pleasure, excessive desire for sex, restlessness, self-harm, slowness in activity, aggression, agitation, self-harm, slowness in activity, weight loss or gain, difficulty in sleeping or excess sleeping, excessive spending, substance abuse are symptoms or what bipolar disorder patients experience. Treatment. The treatment consists of medication and therapy. Medications for this disorder are anticonvulsant, antipsychotic, and SSRIs. The therapies are psychoeducation, family therapy, and psychotherapy. These are the treatments for bipolar disorder. Let's go on to the related conditions of this disorder. We have psychosis, which is a mental disorder characterized by a disconnection from reality. And then we have bipolar 2 disorder, which is a less severe type of bipolar disorder characterized by depression and hypomaniac episodes. Then we have persistent depressive disorder, which is a mild but long-term form of depression. Then we have seasonal affective disorder, a mood disorder characterized by depression that occurs at same time every year. Like if it is coming in January, that means next year January the same thing is going to happen to such patients. We have mood stabilizers for this particular disorder we're talking about. And then the mood stabilizers are lithium, divalproex sodium, and lamotrigine, which are the stabilizers for bipolar disorder 1. Let's go on to how to help a person suffering from bipolar disorder. Living with this condition is not easy, but your support can make a difference. People living with this, they go through a lot, they suffer a lot. But then, with our little support, with the loved ones around, it will help a very, very long way. So that's why I'm bringing the help to you guys, so that you'll be able to help people that are suffering from this disorder. It's not their fault. It can happen to anybody. It can happen to you. It can happen to me. So if you find anybody in this situation, don't mock the person. Help the person out. So let's go on with the help you need. First, you need to educate yourself. You need to learn more about bipolar. You need to know what bipolar is. You need to know how to prevent it. You need to know the causes. In such cases that someone suffering from this disorder is drinking too much, taking so much drugs, abusing drugs, let's put it that way, and then you're there. Since you don't know anything about it, you'll just be watching the person doing all this. But if you educate yourself about this particular disorder, then you are going to help such a patient to minimize or to get attack from this disorder. They're actually cool people. They're very calm. You won't know unless they get the attack. And then secondly, listen. You have to pay total attention to them. Listen to them. And then avoid arguing with them. Avoid topics that irritate or frustrate them. It's not good for their head. It triggers the disorder. It's not good. You need to avoid it totally. Don't frustrate them. Don't make them get angry. Don't argue with them. And then thirdly, be a champion. Always have their back. Make them to know that you are their number one fan, and then you always have their back in whatever they are doing. You're always there for them. The fourth is be active in their treatment. Always take them to the hospital or wherever they're going to their therapist. Wait for them till they are done with their medication, and then they are done with their appointments for that day. It will help them a lot to make them to understand that they are loved, and then that anger will not be in them again. Then the other one is be understanding. Try to understand what they are going through and offer your support. It will help a long way. Another one is you should be patient with them. Always be patient with them. Another one is don't neglect yourself. Okay? There are some times that when you want to help someone, you forget yourself, which is not actually good. You need some sleep as well. You need to eat. You need to refresh yourself and look good at always, like when you're taking care of them. That will also help you. Helping someone with bipolar disorder can be very challenging. Their moods are always low to react or cope. Yeah, like working with someone that it's very hard for the person to react to what you're saying, and then to cope with is actually very tough. It's actually very tough. So that's what you're going to go through if you're helping people with bipolar. And then taking a bold step of helping can make a great difference in their lives. Please, I'm begging you, help someone living with bipolar. If you know anybody close to you that has bipolar, my advice to you is that do not neglect them, do not run away from them, but please help them. That is my own advice to you guys, because this world, so many things are happening in this very world that we are saying today. Like if we check to kill themselves and then their loved ones, it's not as if they plan doing it, but it's because of this illness that makes them to do it. So why can't we just help them? We have several cases in Nigeria. Just in Nigeria, about 1.5 million of people are suffering with this particular disorder every year. We have 1.5 million of people living with this other per annum in Nigeria, which is very, very bad. But we always neglect them. Please, let's not neglect them. Let's always like make them feel better, talk to them, and then help them out. It will help us too. Like we have a case on the 4th of November, which was in North Carolina. Glenn Johnson committed suicide in North Carolina. On the 11th September, this is 2020, Joseph Ajare committed suicide in a border village between Plateau and Kaduna. And then on the 4th of August, Emmanuel Eze, a father of three children. We don't know whether the mother is still alive or not, but he's actually a father of three. Who is going to take care of those 3 kids for him? Like, it's not his fault. He don't know. He didn't even know he was going to do that. But then who is going to take care of those 3 kids for him? Committed suicide in Suka, and also killed his younger sister. That's bad though. The sister never planned of dying that day, but then he committed suicide and killed his younger sister as well, which is very, very, very bad. A recent one happened in Makurdi this November that we are in, close to Christmas. A man killed his girlfriend who wanted, it's not just a man, a married man killed a single girl that he was dating who wanted to marry another young guy that was ready to get married to him. This man killed this lady by setting the house ablaze. He went out, bought fuel, came back, and then set the house ablaze, and then he died instanta. But the lady did not die that day. Now the next day, now she died. This thing is very, very bad. It's very, very bad. So we have to help people living with bipolar disorder. It will help us too. And the thing here is that before you ask me this question whether bipolar is cured or not, it is never cured. But then there are measures by which you can control it. And then they said prevention is better than cure. It's better for you to be taking your drugs. If you know you have bipolar disorder, take your drugs every day. Take your drugs every day as directed by your doctor, to keep you safe, because we want you safe. And it's not just you, the people around you, we want them safe too. We are not always happy when we hear that somebody is dead. Before we come to the end of this video, one last thing I want you guys to know is that before getting into a relationship, or let's say marriage, you have to know the psychological status of your partner before getting down with that relationship. Thank you guys all for watching my video. Please subscribe to my channel and then give it a thumbs up.